Good afternoon, and thank you for joining us for today's National Conference of State Legislatures webinar, Helping States Prioritize Traffic Safety Injury Prevention Strategies. My name is Douglas Schinkel, and I am the Transportation Program Director here at NCSL, and I'll be co-presenting and co-moderating this session today with my colleague Annie Kitch, who you will meet shortly. This is webinar number 2 in the Natural Resources and Infrastructure Committee's 2019 Spring Webinar Series. We have a total of 6 webinars lined up over the series on a variety of topics. There was a deep dive on carbon capture and storage technologies 2 weeks ago, and on May 23rd, we'll cover how experts are attempting to avoid a patchwork of legislation for new transportation technologies. In June, the webinar series will cover the future of plastic from production to disposal and the various policy options legislators are considering. And then the next webinar will look at the emerging regulatory and legislative landscape of cell-cultured meat. And lastly, the policies that are shaping the future of the nation's electric grid. For a complete schedule and registration details, please visit our website at www.ncsl.org. So before I introduce our speakers, I want to review a few housekeeping items. Today's webinar is a platform for information exchange and engagement. Over the next 60 minutes, we encourage participation through our chat box. So feel free to type your questions and answer any questions in the chat box, which is in the lower left hand of your screen. We would like to learn who is participating in the webinar today. So if you could please take a moment now and type in the state you're from, that would be greatly appreciated. We will hold a formal Q&A after all the presenters are finished presenting. And our webinar today is being recorded, and registrants will be able to access a recording of the webinar and presentation slides on NCSL's website after the webinar ends. We will send out a notice once those resources are made available. Additionally, you can download the presentation slides being used today by clicking on the Resources tab, and you can access speaker bios in the Speaker tab at any time during the presentation. So now that housekeeping is out of the way, let's get started. The focus of today's webinar is to hear from Erin Sabor with the Centers for Disease Control and Prevention, otherwise known as the CDC. Erin will introduce us to an impressive CDC tool called MV Pics that can help states prioritize traffic safety prevention strategies and weigh the relative costs and benefits of those interventions. The MV Pics tool includes 14 interventions, and my colleague Annie and I will start the webinar by giving a brief overview of the state legal landscape for 6 of those traffic safety interventions that have the most legislative action. My colleague Annie is a Transportation Policy Associate at NCSL and our expert on traffic safety issues such as distracted driving, impaired driving, and seatbelt and child passenger safety, and you'll hear from her just a little bit later in this presentation. So without further ado, let's get started. So first, I want to just give a quick overview for those of you who do not know what NCSL is. NCSL stands for the National Conference of State Legislatures. We are a membership organization, and our members are the 50 state legislatures and territories and the 7,383 state lawmakers and 30,000 plus legislative staff that serve them. We serve them by providing bipartisan research and analysis, linking legislators and staff with each other and experts throughout the country, and we also serve as the voice for states in Washington, D.C. This slide gives you a quick understanding of NCSL's transportation program portfolio and many of the issues that we cover, and feel free to reach out separately if you have thoughts or questions about anything that's mentioned in here. I do want to mention a handy resource that NCSL has on traffic safety. It's our traffic safety legislative database. We've had this database since 2007, and it summarizes bills, all relevant traffic safety legislation introduced between 2007 and 2019 in 15 topic areas. There are a lot of different search functions in this database. You can do a keyword search as well. And this is supported by NCSL's cooperative agreement with the National Highway Traffic Safety Administration. We've had this cooperative agreement for about 25, 26 years now, and are very appreciative that they enable us enable NCSL to compile and keep apprised of the latest developments related to traffic safety in state legislatures. So this slide gives you a quick overview of what Annie and I are going to discuss in our presentation. As I mentioned before, we're going to focus in on a few interventions that we've seen quite a bit of state legislative action on, including automated enforcement, i.e. red light cameras and speed cameras, motorcycle helmet laws, and then I'll turn it over to Annie, and she'll talk about ignition interlock devices and seatbelt and child passenger safety. So without further ado, let's get started, and we will start off with red light cameras. So motorists disobeying a red light is a dangerous yet common occurrence. According to the Insurance Institute for Highway Safety, in 2016, crashes caused by red light running resulted in at least 811 deaths, with over half of the deaths consisting of bicyclists and pedestrians. Automated enforcement technology, i.e. red light cameras and photo radar, allow law enforcement agencies to enforce traffic laws remotely by detecting motorists that violate traffic regulations. Red light cameras specifically are linked to traffic signals and monitor the green, yellow, and red phases of traffic lights. When a motorist drives through an intersection after the signal is turned red, sensors trigger the cameras to take two photographs, one of the vehicle entering the intersection while the light is red, and one showing the vehicle traveling through the intersection on a red light. Results of studies on the effectiveness of red light cameras vary, but mostly show a positive impact on traffic safety. Rear-end crashes may increase, but those are typically low-severity crashes compared with the high-speed, right-angle collisions targeted by red light camera programs. A 2016 IIHS report compared trends in annual crash rates in 14 cities that had ended their camera programs with those in 29 cities in the same regions that continued their programs. They found that after adjusting for other factors, red light running crashes increased by 30% at intersections where cameras were removed. Politically, red light cameras remain contentious, and contrasting results from studies can enhance skepticism depending on how they are administered and which intersections are chosen. As you can see on the slide here, city and local governments in 22 states and DC use red light cameras. In most cases, state legislatures have passed enabling statutes with specific provisions to allow local governments to develop red light cameras. According to IIHS, 389 communities in the United States have red light cameras as of May 2019. Lastly, I want to note, and Annie is going to drop this resource into the chat box, a cohort of traffic safety organizations, including IIHS and AAA, developed a red light camera program checklist in 2018. They noted that successful programs have strong public information campaigns, are transparent, and emphasize safety over revenue. They also suggest a grace period before a vehicle is photographed of up to half second and no less than eighth of a second after the light turns red. They note that a good program should actually lead to less revenue over time as fewer drivers run red lights. So let's next talk about speed cameras. So there were 9,717 speeding-related deaths in 2017, according to NHTSA's latest data, which is just over a quarter of the 37,000-some traffic deaths in 2017. So photo radar functions are typically housed within a mobile unit, such as a van or truck, and the photo radar system is equipped with both speed detection devices and cameras. Once a speeding vehicle is detected, the camera is triggered. The photos stamped with the date and time are used to identify the vehicle owner, and tickets are issued. IIHS looked at crashes on camera-eligible roads in Montgomery County, Maryland, where speed cameras were introduced in 2007, and compared them to other similar roads in Virginia, which does not have speed cameras. The study found that camera programs had reduced by 59% the likelihood of a driver exceeding the speed limit by more than 10 miles per hour on camera-eligible roads. They found that the speed cameras resulted in a 19% reduction in the likelihood that a crash would involve a fatality or an incapacitating injury. Communities in 15 states, which you can see represented on the slide there, and the District of Columbia use speed cameras. And Pennsylvania will join them in late 2019 when their new legislation takes effect that I will discuss in a moment. Although Iowa and Ohio have no specific statutes, cameras are used in certain cities there. And as of May 2019, 141 communities throughout the U.S. have speed camera programs. And two things of note that have happened recently with speed cameras that I want to talk about is that in New York City, they had a pretty high-profile school zone speed camera program, 140 cameras, and those were shut down in the summer of 2018 due to the expiration of a 2013 law authorizing their use. Data from the New York City Department of Transportation showed that the cameras reduced speeding during school hours by 63% and injuries by 17% between 2014 and 2017. The legislature in March of this year did enact a bill that would expand the program from 140 cameras to 750 in school zones throughout New York City, part of a larger Vision Zero effort. And one thing that's pretty obvious when thinking about automated enforcement is that probably the political will for it is higher when it comes to things with vulnerable populations, i.e. in school zones or for school bus cameras. The other thing I do want to note that is that in 2018, Pennsylvania enacted Senate Bill 172, which will establish 2 5-year pilot programs for automated speed enforcement along the entire length of Roosevelt Boulevard in the city of Philadelphia, which has experienced a lot of traffic fatalities, and in active work zones, which is another area where the political will and the seems to be higher to try and protect construction workers trying to improve our roads. And so with that, I'll turn to the last part of my presentation, which is motorcycle helmets, and then we will turn over to Annie. So it's important when talking about motorcycle helmets to have some historical context. In 1975, helmets were mandatory for all riders in 47 states and D.C., partly because federal highway funding was tied to having such laws. The Congress removed that requirement in 1976, and then more recently in 1995, they repealed financial incentives offered to states in the early 1990s. Since then, Arkansas, Florida, Kentucky, Louisiana, Michigan, Pennsylvania, and Texas have relaxed or repealed their mandatory universal helmet laws. Louisiana weakened its law in 1999, but then did reenact a universal law in 2004. So currently, there are 19 states, D.C., Guam, the Northern Mariana Islands, Puerto Rico, and the U.S. Virgin Islands still require all riders to wear helmets. Another 28 states require helmet use for certain groups, typically those under age 21 or age 18. If you talk to traffic safety stakeholders or law enforcement officials in the states that don't have a universal helmet law, what they will tell you as soon as it's not a universal law, it becomes much more difficult to enforce, because in a universal state, it's very obvious. If you're on a motorcycle, you need to have a helmet on. Once it becomes something where you have to gauge and determine if they have the age, if they're the right age, it just becomes more difficult to enforce. I will note that the trend that we're seeing is that laws in Florida, Michigan, and Texas exempt riders who carry a certain amount of insurance or who pass a safety course or both, despite there not necessarily being a lot of evidence showing that those exemptions have a safety benefit. And lastly, there are 3 states, Illinois, Iowa, and New Hampshire, that do not have any helmet requirements whatsoever. And with that, I will turn it over to my colleague, Annie Kitch, and thank you for listening to my presentation.
All right, thanks, Doug. So as Doug mentioned, I am Annie Kitch, and I am also a member of NCSL's transportation program, focusing primarily on traffic safety matters such as impaired driving, distracted driving, seatbelt laws. And thank you all for joining us today. I'll second Doug on that. I'm seeing some familiar names and some new names, which is always fun to see. So with that, I'll just jump right into the next topic, which are state ignition interlock device laws. And just to provide a little bit of an intro or overview, NHTSA's latest data shows that 10,874 people were killed in alcohol-impaired traffic crashes in 2017. And so with those numbers, states have continued to enact and revise some of these ignition interlock device interventions. And just for those of you who don't know, an ignition interlock device is a car breathalyzer that controls the vehicle's ignition system based on alcohol concentration of a driver's blood alcohol content to prevent the vehicle from newer technology potentially from starting or alerting a device manufacturer of a person's higher BAC level. I'm sure a lot of you are aware of what they are, but you never know. So with that, Currently, 28 states require ignition interlocks for all offenders. So that means both first-time offenders all the way up to those offenders with higher blood alcohol content limits. And most recently, Idaho and Iowa became all-offender states in 2018. And we have some other state movement this year that I'll get into in the next slide. And then next, 10 states currently require ignition interlocks for offenders with a high blood alcohol content and repeat convictions on their record. And lastly, an area where we're seeing the most movement lately are states requiring all or some offenders to install interlock devices with cameras. And this ensures that the driver is blowing into the device versus a passenger who might have a lower blood alcohol content limit. And most recently in 2019, Idaho, Maryland, and Kentucky have enacted these camera requirements. And happy to talk about any of these totals after the webinar during the Q&A period. Go to next. Oh, sorry, a little technical difficulty. Is that going? Oh, there we go. Is it on yours? Okay. Sorry about that. So next you'll see a map that just highlights those numbers that I just referenced on the other slide, along with all of the state ignition interlock laws. So you'll see that every state has enacted some form of an ignition interlock device law. And you'll see this map on NCSL's website. And Doug, oh, is that not? Okay, sorry about that. And Doug will also send a link to the website in a moment. And an important thing to note before we move on, some traffic safety organizations classify all offender states differently. So you may see a higher total with other traffic safety organizations on their websites. And the reason for this difference is that NCSL's total is based off of state statutes versus court-mandated program requirements. So for example, in Colorado, first-time offenders are highly encouraged to install ignition interlock devices with various incentives such as license reinstatement, but the statute does not actually require an individual to install a device upon first offense. So happy to talk about our totals and that kind of caveat in the Q&A section as well or after the webinar. So next, thanks for your patience. We're just playing with our software. Oh, I'm not on the server. Okay. So next I'm going to dive into state seatbelt laws. Oh, sorry, we're kind of having a little wonky technical difficulty. Thank you. I'm back on. Sorry about that. So next I'm going to dive into state seatbelt laws, which are also a critical intervention that is included in the MV Pics tool that Erin will cover later. And so apologies, we're having some technical difficulties on our end with our Wi-Fi, so thanks for your patience. So NHTSA's latest data shows that more than 10,000 individuals who died in crashes in 2017 were not wearing seatbelts. So with these numbers, states have continued to enact and revise their state seatbelt laws. So you'll see on this map, which you'll also be able to find on the NCSL's website shortly, we're just updating it. You can see that these state seatbelt laws vary pretty widely. So you'll see that some of the states are designated in darker blue, and these are our primary enforcement states. And as some of you may know, these laws tend to be a little bit stricter. And primary enforcement laws are a little bit stricter because they allow an enforcement officer to pull a driver over for not wearing a seatbelt without any other offense taking place. Whereas a secondary enforcement law states that law enforcement officers may issue a ticket for not wearing a seatbelt only when there is another citable traffic infraction or citation offense, such as running a red light. And you'll also see here on the map that those primary and secondary enforcement laws expand into the back seat. And so we're seeing a lot of legislation this year especially. You'll see in that orange box that at least 10 states have considered legislation that requires that all passengers should be buckled up, both in the front and back seat. And whether that is primarily or secondarily enforced in the backseat varies. And you'll also see that a few states who currently do not have primary enforcement laws have considered primary enforcement, but as of now, none of those states have enacted legislation. And lastly, something else to note that you'll also see on the MV Pics tool is that states have a wide range of seatbelt fines. And so some of our research shows that the maximum fine for a first violation of a seatbelt law is up to $30 in at least 31 states, and between $30 and $100 in 11 states and DC. And lastly, 7 states have fine over $100 pending court fees for a first offense. So you'll see that that range is pretty broad. It can go slightly below 30 all the way to 100 and above. I'm trying to do it. And so lastly and importantly, states are also actively examining their child passenger safety laws to better protect children in vehicles. And according to NHTSA, of the 37,461 vehicle fatalities in the United States in 2016, 1,233 of those fatalities were children under the age of 14. And so again, considering these numbers, just as states have done with the last couple of interventions we've discussed, they're starting to really hone in on these laws, and a handful of traffic safety organizations, along with the American Academy of Pediatrics, have strongly encouraged states to require children to remain in rear-facing safety seats until the age of 2. And so in response to these recommendations and growing evidence that this is a necessary intervention, we're seeing that more states are aligning with the requirements that these organizations and the AAP have suggested. And so notably this year, the most recent state plus DC locations to enact this specific law are Washington and DC, as I just mentioned, bringing the total up to 13 states, I believe, as over the last month. So there's been some very recent movement in this space. And the other states that do not require children to be rear-facing until the age of 2 generally require them to be rear-facing until the age of 1, which was the previous recommendation. And so, with that, I would like to introduce our next speaker, Erin Sabor with the Centers for Disease Control and Prevention. Erin serves as a team lead for the Transportation Safety Team in the Division of Unintentional Injury Prevention. She's responsible for overseeing all of the CDC's transportation safety activities and areas of focus such as restraint use and impaired driving. Erin, thanks so much for joining us today, and we will turn it over to you.
Great, thank you, Annie. And thank you to NCSL for inviting me to be here today. I'm excited to be here to talk to you about the MV Pics tool. And if I can ad-lib for a second, another thing to keep track of around child passenger safety laws in the different states are the changes in booster seat laws. So we know that keeping kids in a booster seat longer is actually safer for them because it makes sure that the seatbelt is positioned properly on the bony parts of their body. So in addition to keeping those younger kids rear-facing longer, we also want to keep them in booster seats for an extended period of time. So just a little ad-lib there. I'm a child passenger safety technician as well, and it's my personal area of research, so I just wanted to add that in. But what I'm really here to talk about today is to introduce you to a CDC tool that will give you the information on how to save lives, prevent injuries, and avert medical costs in your state.
Hey, Erin.
This tool,
Hey, Erin.
Yes?
Sorry, we're having,
Yes?
this is Doug here. We're having trouble hearing you. Your phone is cutting in and out. I wonder, or the sound's not coming through very well. I'm wondering if you can try maybe a different phone. No.
Yep, I can do that.
And apologies to the audience. We want to just pause and make sure that we took the time to put this webinar together, so let's make sure that Erin can present and we can all hear her information. So let's just pause for one moment.
Okay, I'm going to try this phone. Is this better?
Much better, Erin. Thank you very much, and appreciate the patience from the audience. Thank you.
Thank you. Okay, guys, let's get back to the presentation. Okay. So I will start over after my ad lib about child passenger safety, but I heard that I was going in and out, but just another area to keep track of with child passenger safety policy is around booster seats. So today, what I'm here to do is to introduce you to a CDC tool that will give you information on how to save lives, prevent injuries, and avert medical costs in your state. This tool is called MV Pics. And it's MV Pics 3.0 because we've actually gone through a couple different updates with the MV Pics tool. And before I dive into the tool, for those who don't know, the Health and Human Services in the United States has 11 different operating divisions, one of which is the CDC, or the Centers for Disease Control and Prevention. And briefly, CDC works 24/7 to protect America from health, safety, and security threats, both foreign and in the U.S. And within the Centers for Disease Control and Prevention, one of the centers is the Injury Center, or the National Center for Injury Prevention and Control. And at the Injury Center, we focus in on both unintentional and intentional injuries. One thing that we do within the Injury Center every year is we produce the 10 leading causes of death by age group in the United States. And that's exactly what this chart is here. It shows the leading causes of death by age group in the United States for 2017. So you can see for people aged 1 through 44 in the United States, the leading cause of death is unintentional injury. And by unintentional, I mean things that are typically thought of as being accidents. However, we know that there are things that people can do in order to prevent these injuries. So if you break down the types of injury by leading cause of death, all of the colored boxes here are different injury causes of death. And the highlighted boxes in blue are the motor vehicle crash deaths. And so you can see across the different age groups, motor vehicle crashes remain a leading cause of injury death when looked at more closely. Of interest, the green boxes are unintentional poisonings, which helps to highlight the opioid epidemic in the United States. Before motor vehicle crashes, as Doug and Annie said, there are over 37,000 motor vehicle deaths in the U.S. every single year, but it's important to think about the full impact of motor vehicle crashes. For every one person killed in a motor vehicle crash in the U.S., 8 people were hospitalized and 99 people were treated and released from emergency departments. So from a health perspective, this really has a large burden on our medical care facilities and our healthcare system as a whole. So within our injury center, I'm the team lead of the transportation safety team. And in my team, our vision is to keep people safe on the road every day. And our mission is to reduce injury and death due to motor vehicle crashes and promote safe travel. So one of the ways that we're seeing this vision and mission being realized was through the development of our MV Pics tool. MV Pics stands for the Motor Vehicle Prioritizing Interventions and Cost Calculator for States. So this is a free interactive calculator. It's online. We created it primarily for states and state decision makers to use in order to help them decide how to reduce the most injuries and deaths in your respective state for every dollar spent. Through the MV Pics tool, which I'll go through here in a minute, the user defines the budget, and then the user can also pick from 14 effective interventions in the tool. And then MV Pics will calculate the expected number and monetized value of injuries prevented and lives saved, as well as the cost of putting the different interventions into place in the state. And so why is MV Pics important? Well, as I said, there are so many deaths in the United States as well as non-fatal injuries. On average, we lose 100 people every day in motor vehicle crashes, and thousands more are injured. In addition to these lives lost and injuries, the economic impact is really quite notable. In a one-year period, the cost for medical care and productivity losses exceeds $63 billion in the U.S. And as I said, motor vehicle crashes are preventable. One thing with working in transportation safety that really keeps a lot of us motivated is there's so many things that we know that work that can be put into place. So working in transportation safety is really a way that you can get a lot of satisfaction with your job because you can really and truly make a difference. And we also know with these interventions that more can be done to prevent crashes and reduce injuries. And of course, state-level changes are especially effective, which is why with MV Pics we focused on state-level data. So if you Google or look for MV Pics, this is what the website will look like where the online calculator lives. There is the first link on there says MV Pics 3.0. So to activate the calculator, you just click on that link. And that will take you to a page where you can get started. And the way to get started is just to select a state. So there's a map view and a table view. You can hover over your state of interest and go ahead and click on the state. And once you've selected your state, the next thing that you will see is a box where you can start your analyses. So at the very top, you'll see that $sign, and it says enter a budget amount here. And so for this example, I've put in $1 million budget for the given state. There are several options within MV Pics, which is another great thing about the tool because you have the ability to make adjustments. So I'll talk about this a little bit later, but as Doug and Annie were talking about, there are lots of changes in legislation in the states. And so you can make adaptations to the tool in order for it to recalculate the outcomes based on changes that we might have either seen with research and or policies in the states. So for this example, I'm selecting the Use Fines and Fees option of the tool. And so what this does is it assumes that any fines and fees that come out of an intervention are fed back into the tool to allow the state to essentially purchase more interventions. So for instance, if, say, the Redlight Cameras generated, say, $500,000 in fines and fees, MV Pics, when you click on Use Fines and Fees, would add that $500,000 back into the tool to allow you to select more interventions. So some states do have the funds set aside from traffic safety to go back into traffic safety. So that's what the Use Fines and Fee option is. And again, you can select or not select that option. So once you, I'm going to go back really quick. So once you put in your budget and use your decide whether or not you want to use your fines and fees, then you click on the purple box that says Run Model. And so for the state in this example, here it shows all the different interventions that are in MV Pics. So there are 14 different interventions which were selected because they are behavioral focused. So at CDC, we focus on the human factors or the human behaviors that contribute to crashes and or injuries. And so all of these interventions have been shown to be effective in NHTSA's countermeasures that work. So this is a really nice resource if you don't know about it that shows the effectiveness of different interventions really across the transportation landscape. So these interventions have been determined to be effective, however, not in widespread use among the states. So we wanted to pick things that really had the option to make more of an impact across a larger number of states. So you can select really any of these interventions. It's pre-set up so that if your state does not have this intervention in place, that the tool will pick it. But again, with MV Pics, the user's in charge. So you can force things in or force things out as you choose. So if you know there isn't really any political capital around a certain intervention, you can take it out of the model to see where else you might be able to make a big impact. So once the interventions are selected, then you, again, run the model. And that will bring you to the results of MV Pics. And so with that $1 million budget, including the fines and fees, the model selected, and sorry, I'm clearing my throat, I'm getting over a cold. The model selected interventions including alcohol ignition interlocks, bicycle helmet use for children, increased seatbelt fine, in-person renewal, which is in-person license renewal for people age 70 and older, license plate impoundment, universal motorcycle helmet laws, red light cameras, and seatbelt enforcement campaigns. And so with the $1 million budget and including the fines and fees back in the model, it's estimated that these interventions in a year will save 123 lives, prevent 7,609 injuries, and the monetized value of those lives saved and injuries prevented in averted medical costs and productivity costs is $369.61 million. Now, with these monetary benefits, we actually are a little bit more conservative than some of the other estimates that are out there, because we really do like to look at the more short-term costs that can be averted. So I'm happy to answer questions about that later, but it's also detailed in our final report for MV Pics online if you're an economist and really interested in how we got to these calculations. And then the total cost column is the implementation costs. So in order to put these interventions into place, it's been determined that you need $10.94 million. Now you'll see that this is over that $1 million budget I put in, and the reason that this state is able to essentially purchase these interventions is because the fines and fees collected from them are $9.99 million. So that almost $10 million plus the $1 million I put in there allows us to select those interventions. So the net cost is that $0.96 million. So this is one piece of the MV Pics results. And if I gave some of the longer titles for the interventions. Within MV Pics, we have fact sheets on each of the different interventions. So if you want to learn more or the history about them or where you can find out more information on the different interventions, there is an info button next to each of them. So another piece of the results that you will get with MV Pics, it breaks down the potential lives saved with the selected interventions. So of those interventions, it shows you where you're saving lives, how that adds up to those 123 lives. So for instance, with this pie graph, you can see that the increased seatbelt fine has estimated that 29 lives will be saved by increasing the seatbelt fine. So we know that seatbelts are one of the best ways that people can protect themselves in a crash. And so it makes sense that increasing a seatbelt fine encourages more people to buckle up, always buckle up, and so this would save lives. So you can see the other estimates with motorcycle helmets, red light cameras, license plate impound, etc. So similarly, for the injuries prevented, there's a pie graph there, so you can see what pieces of the pie make up that total 7,609 injuries prevented. And then the monetary benefit is also detailed out in a pie graph, so you can see where the dollars are that you're saving. Again, it makes sense that increasing seatbelt use would reduce the medical costs for injury because it helps prevent injuries and reduces the severity of injuries when they do occur. And if you don't like pie graphs, we also have bar charts in the MV Pics output that shows you the different slices of the pie. So the fine fees are broken out in that bottom bar graph that goes to the left. So that shows where really you're picking up a majority of your fines and fees. So for instance, the yellow there, increased seatbelt fines, is part of the fines and fees, and then you've got license plate impoundment is the other big piece. And then the costs are on this upper right bar graph that shows you the different costs. So the implementation costs and then the fines and fee costs for each of the interventions. And then if you're really into data, which I'm an epidemiologist, so I have to admit that I really do like data and big tables, here are the intervention details. So the ones highlighted in blue are the ones that were selected by the model. And then it shows you in a table format the lives saved, injuries prevented, cost to implement, fines and fees, net costs, as well as benefits. Now, one thing I told you that I really personally like about the MV Pics tool is the ability to change things within the tool. And so here, this is a sensitivity analysis. So in the one of the beginning screens, you'll see underneath where you enter in the budget and then the fines and fees, the sensitivity analysis box. So this allows you to make changes on the default values for the percent reductions in deaths and injuries, as well as the dollar value of saving and preventing injuries. So let me give you an example of that. So for changing the values in the sensitivity analysis, say for instance in your state you actually know the average medical costs for a person that dies in a motor vehicle crash, or the average cost for an injury in your medical facility. You could go in and put the cost of preventing an injury, so that could be, your average cost of treating someone who's been injured in a motor vehicle crash in your hospitals. You could actually put your state-based value in there, and then also, for instance, the benefit of saving a life. And so you are able to adjust things within MV Pics and rerun the calculator to have that affect your output. So this is also nice because as those laws change and as we have more research and estimates coming out, the tool basically is a live thing where you can make those changes and still see what the outputs would be. And then similarly, for the injury reduction factor and fatality reduction factor, again, this was based on literature review and countermeasures at work and other documents that are well established in the literature. So but we actually know much more about the fatality reduction factor than we do the injury reduction factor. And so you see across many of these, the fatality reduction factor had to be used also for injury reduction because there weren't necessarily good studies on the reduction in non-fatal injuries because, frankly, we just don't have multi-state or national data on non-fatal injuries yet. And so if we were to have updates in how much an intervention would reduce your risk of fatality or injury, those adjustments can be made here and rerun the model. So this is a little bit beyond some of the regular users, but I just wanted you to know that these options are there. And then what we really want people to do is share the results. So when you run MV Pics, it helps you to find the most cost-effective ways to spend what we know are often limited dollars on motor vehicle injury prevention. It helps you determine which interventions will save the most lives and prevent the most injuries in your state. And it also will help you look at annual estimates for the cost and effectiveness for various policies and programs in your state. So we also created in the most recent version of MV Pics the option to print a report, so you can print and share your results to anyone that might be interested in this data. And most recently, we released an MV Pics widget, and the widget can be used on a mobile device, and it will give you a summary of the issue in your state, but it's not at the very detailed level of the actual MV Pics tool. But I did want you to know that that's out there. And so that's my summary and overview of MV Pics. It's a lot of information, but we've really worked hard to make sure that it's user-friendly and something that you can take with you when you're having discussions about transportation safety and what you can do to save more lives in your state and prevent injuries. Because I'm from CDC, I also wanted to take a minute and just share with you some other resources that we have available, both at CDC and more broadly. The first is the Road to Zero. So beginning in October 2016, the Department of Transportation, including NHTSA, FHWA, and FMCSA, through the National Safety Council, launched the Road to Zero initiative. So if you've heard of Vision Zero, Towards Zero Deaths, Road to Zero, the main point I want to make is that getting to zero is a common goal across people in transportation safety. Road to Zero is trying to get to zero road fatalities in the United States by 2050. So if you have not looked to see if your states or some of your cities have Vision Zero or Towards Zero Deaths, this is something I recommend doing because there are a lot of groups actively working towards getting to zero in states and cities. I wanted you to be aware that CDC has state-based fact sheets, and they're actually being updated as well as others being developed. So we will have these on our website probably in January 2020. But we have state-specific data on restraints, alcohol-impaired driving, and costs of motor vehicle crash deaths. These are available now, but I believe the data are 2012 or 2014, and so the updates will be the newest data that are available. Also at CDC, we have worked for decades with the Indian Health Service on injury prevention with tribal communities. And so we do also have resources if you have tribal populations in your states or if you yourself are from tribes. We have a tribal communities toolkit and a best practices guide for motor vehicle injury prevention with American Indians and Alaskan Natives. And also, if you're not aware, CDC funds several different programs within the states. So we have what's called our Core State Violence and Injury Prevention Program, or Core SVIP State. states, this is funding to 23 different state health departments, and we also fund injury control research centers. So you can look into these and see if your states or communities have these. It's another good way to leverage partnerships as well as funding for transportation safety. And finally, I just wanted to let you know that the one area that we've been working in a lot at CDC recently is data linkage. So as I mentioned, we do not have a good multi-state or national data system for the non-fatal crashes in the United States, which every year there are 3 million people injured in motor vehicle crashes that we don't have good data on. So we've been working with the states to help them either improve data linkage they're doing or begin to link data. And one of the things that we did is developed this links guide. So it's really a how-to manual and things to think of how to either establish or start doing data linkage. So this will be coming out this fall. So that's all I have. I thank you very much. I'm looking forward to any questions that there might be. And I'll turn it back over to you, Annie and Doug.
Thanks, Erin, and we really appreciate you sharing your expertise and for the CDC's continued partnership and your willingness to take the time to join us on the webinar. I just want to kind of reiterate, traffic safety is such an important matter, as you all know, and it's a topic and matter that's largely left to the state. So we really appreciate the CDC's efforts in developing this resource and this tool, and really looking forward to seeing how it evolves and what feedback the CDC gets, and so just really great to learn a little bit more. So I'd like to shift gears into the question and answer portion of today's webinar, and it looks like we have 11 minutes. So if anyone has any questions, feel free to enter it into the audience chat box, and it looks like we have one question. I will open one comment. Let me pull that up. So it looks like, I believe you may all be able to read this, and I'm just going to read over it. Thanks for your patience. I have a question I wanted to plug. Okay, thank you so much for that comment, Julie, and it will be sure, and this will be saved on the webinar as well, so you all will be able to receive that information. And if any of you have any questions about that or any other comments. And we, I believe, have some questions on our end. I have a specific one for you, Erin. You mentioned that the seatbelt fine interventions have brought in large amounts of revenue, fees, fines, stuff like that. And I was wondering, and this might be kind of a hard question to answer, is there a golden number for a fine that really starts to bring in that revenue? During my presentation, I mentioned that there's such a broad range of fine amounts, and so I was kind of curious to see if your team had come across any information on that.
Yeah, that's an interesting question, and it's something that let me define a little bit more. So one of my team members recently updated me that as of January 2019, the state seatbelt fines for adults ranged somewhere between $10 and $200. But then she reported that, and that might be less recent than the data that you have, Annie. But for our increased seatbelt fine in MV Pics, the way, and I would say that the interventions that are in there, we had to make sure that they were transferable across the states, which is another reason that we like that you can either add in an intervention or take it out. Because there are some instances where maybe a city in a state is doing an intervention, but statewide it's not very well used, and so we would indicate that that state did not have that intervention in place. But as far as a magic number for seatbelt fines, not that I've seen. For our seatbelt fine intervention in MV Pics, it's to add $75 to the state seatbelt fine, but that's only if the state had an existing fine that was less than $70. So, it's keeping within the range that's already there, but basically taking the states that have that lower seatbelt fine that might not encourage someone to buckle up and just bumping it up a little bit more.
Gotcha. Okay, thank you. And I think Your number was also very correct in that it does creep up to 200 with extra court fees and all of the other fees that can kind of be tacked on. So I think it is higher than we listed, but thanks for that, Erin. That was super helpful.
Sure thing.
Yeah.
Do you want to? I have. Erin, this is Doug. I have maybe one or two questions. The first one maybe I'll ask is that there has been perhaps, I don't want to say progress isn't the best word, but there's been maybe decent progress made in the last 10, 20, 30 years in reducing motorist deaths, although with the increase in vehicle miles traveled and just some of the trends we've seen the last few years, where maybe some of that's chipping away, but that the injury and crash rates are persistent and on the rise, particularly for vulnerable users such as bicyclists and pedestrians, because of course they don't really have any, there's been a lot of improvements made in automobile safety, and those are not realized by, vulnerable users because they're not in an automobile. So I'm wondering if you have any insight on interventions that are particularly important or helpful to help protect vulnerable users.
Yeah, sure. So I really would recommend taking a look at the countermeasures that work that I mentioned from NHTSA, the National Highway Traffic Safety Administration, because they not only include the behavioral interventions that CDC focuses on, but also infrastructure and vehicle interventions as well. And so for pedestrians and bicyclists, some of the interventions that have really been pushed by cities and others are, one, reducing speed, because the science around a pedestrian or bicyclist being hit by a motor vehicle at different speeds is really clear, and it's actually really interesting to see the curve of how, at the different increases in speed, how much your risk of dying in a crash goes up with speed. So reducing speed, traffic calming interventions, also making sure that there's protective space for pedestrians and or bicyclists on the road are some of the interventions that have been shown to be effective in different states. But yes, you're right that the advances in vehicle safety have helped the occupants of motor vehicles, but not our more vulnerable road users that are out there, including the bicyclists and pedestrians.
Thank you. That's very helpful, Erin. One other trend that we've seen that we considered including in our presentation, this is Doug with NCSL, is that, like you alluded to, the difference in a vulnerable user being struck by a vehicle at 15 miles an hour versus 20 versus 25, 30, 35, really every 5 miles per hour, or maybe not even that you bump up, you're really increasing the chances of them being seriously injured or killed. And there has been movement. There are now, I believe, 8 states that in the last 7 or 8 years have enabled localities to have more flexibility to lower their speed limits in areas where they think that's appropriate, in school areas, heavily residential, or where there's a lot of kind of businesses in a downtown area. A lot of the existing kind of laws in most, but maybe not all states, require quite a bit of kind of in-depth study, and sometimes doesn't even leave it up to the locality. And, there's so many instances of a community having a state-run road in their community, and so sometimes they don't even have control over that. So it's been interesting to see that that approach taken, and some of those states that have done that have been kind of successful. Have been Oregon and Massachusetts, and in Boston, I believe, IIHS did a study showing that there was already, when they made that speed limit change, that it was already having an impact in terms of slowing people down. So that's just kind of interesting to see. I don't know if did you have another question, Annie?
Yeah, we have about, looks like 3 more minutes until we have to close. Does anyone have any questions for the chat before I ask another one, because I'm so curious? My chat's disconnected, but okay, I'll go ahead and jump in on mine. But Erin, Doug and I were both curious. Have you received any feedback from states or local governments or law enforcement agencies that have used MV Pics?
Yes, so as I mentioned, we've updated MV Pics a couple of times. And so in the second version, we worked with our states that were funded through CDC's Injury Center to get feedback on what they felt was good about MV Pics, what they needed. So really did an evaluation of the tool. And so that's why the most recent version has really been updated to be more user-friendly, to help a wider array of audiences use and understand the data. We have heard from states that they have used the tool for specific interventions that maybe were being considered to be repealed, and where they were able to run the specific intervention for their state and show the effectiveness and how many lives were estimated to be saved and injuries prevented. So it's been used not only to make decisions about which interventions could get a state the most bang for their buck, so to speak, but also what they might see if certain things were repealed.
That's very helpful. It strikes me that this information could be really helpful to those in states that are developing fiscal notes and legislative analyses of bills and what have you. So that's some really helpful insight. Thank you, Erin.
Thanks.
Sure.
So if we don't have any other questions, I think we're good. I will just close out today by extending a final thank you to you, Erin. This was great to learn more about this tool, and thank you to all of you that joined and participated today in the webinar. And just as a reminder, a recording will be on NCSL's website, and you'll also have access to the slide deck as well as the actual audio. And just a NRI webinar plug, NCSL's webinar plug. The next webinar covering new transportation technologies will be in 2 weeks, and you can register, as we mentioned at the beginning of the webinar, on ncsl.org, or you can email Kristen Hildreth, and I will go to our final slide. There we go. Thank you. For more questions on the webinar, and so here's just a list of all of our webinars over the next few weeks going into the end of June. So again, if you have any questions, our contact info is on the next slide. So without further ado, I will close this out, and thank you all for joining us today.
Thank you.
And Annie, can I just say that if anyone needs help using the tool, so if you start to work with it and run into any issues or questions, I'm personally more than happy to help any of you use it. And it's Global Road Safety Week this week, so this was really timely. So thank you.
Thanks, Erin.